There are many ways to define OCD. One of the simplest ways is to define it clinically by what do you actually see and what do patients actually do when they have OCD. And there are typical symptoms like hand washing. Some people wash their hands for an hour or two a day. Some people wash up to 12, 14, 16 hours a day. There are checking behaviors, so people check stoves, doors, car doors, and so forth. And then there are other kinds of symptoms where people get stuck with particular thoughts that go around and around in their head, and they're not able to go out, they're not able to function, and these thoughts are just tormenting them. Sometimes they can be thoughts that they might hurt somebody, other times they're just totally neutral or benign thoughts. One woman made a puzzle with her son, and there was one piece lost at the end, and she started to obsess about that piece of the puzzle, couldn't go to work, couldn't cook, and so forth. There are other people that do things that until things feel right. They might walk across a threshold and then have to go back and forth, for instance, across a door threshold until it feels right and they get some kind of internal feeling that things have been done correctly. They know there's no consequences of this, but that uncomfortable feeling just drives them nuts and they feel like they have to do it. And it can pretty much take over their whole lives. When I was looking around early on for a career in medicine, OCD appealed to me as a disorder to treat because it seemed like the patients had an enormous amount of suffering. The patients were not psychotic, they were in touch with reality, and yet they had this incredible suffering, more than even cancer patients. So you have fairly normal, reasonable, rational people, and they're doing these kinds of behaviors for hours a day, and they're just tormented by these kinds of things. So I decided that would be a reasonable way to spend my life working with OCD patients. I consider it pure suffering from the descriptions that the patients give me. I remember early on in my career, there was one young man, 19 years old, I think, who had terminal kidney cancer. He was going to die before he was 20, and it was pretty clear there was nothing that could be done. And he told me that he would rather get rid of his harmful, obsessive thoughts than get rid of his cancer. And that's when it really struck me that this really is a horrible illness and people suffer immensely from this.